This segment is sponsored by Advanced Pain Care. Advanced Pain Care has been dedicated to improving the quality of life for those in pain since 2002. It's about 20 years now. So Dr. Michael Albrecht is here today to go in depth about advanced orthopedics and the role it plays in pain management. Doctor, good morning to you.
Well, good morning, Rosie. Thanks for having me.
Thanks so much for being with us. We love having expertise like yours on the program. So let's talk about it. Let's brag on you for a moment because you've been practicing here in Austin over that 2-decade mark. You're about to round out 23 years. So what made you decide to join Advanced Orthopedics?
Advanced Orthopedics really gave me a blessed opportunity to try something new in orthopedics, something that's a little bit different for the practice style of orthopedics, which is doing it from a perspective of pain care. Mark Malone, he started Advanced Pain Care years ago. He developed advanced orthopedics and also advanced neurosurgery and even advanced rheumatology, all with the common thread of pain, which is a little bit different. How I practiced for so many years was I thought my patients came in and they wanted to see me for their meniscus tear, or they had their rotator cuff injury, or they had arthritis or a broken bone, and that's why they were coming to see me, which was true in a way. But if you think about it, and this was the brilliance of Dr. Malone, what they wrote on their intake form was that they had pain. Sure, pain is related to all these things orthopedically. They really come in mostly because they have pain. So in this style of delivering health care, it's really very comprehensive. We now have a number of specialists from different fields that can all collaborate with a patient on their issues of pain. One of them may be orthopedics, or very easily it could be something related to neurosurgery. And it's so easy to have our patients collaborate among different specialties.
Wow, this is pretty genius.
Well, it is.
I haven't heard of a model like this before. So we're really lucky here in Austin to have you guys all collaborating together. And I wanted to circle back to what you were talking about there, kind of the nexus of that idea with pain control. Does it offer an advantage for something like orthopedic surgery patients when that is the focus?
Think about having a surgery on your shoulder, your knee. You know, the number one thing I think most patients really fear is pain having the procedure. I know I do. I'm kind of chicken. I don't want to go through procedures if I don't have to. I do worry about pain. And so do my patients. Our very own anesthesiologists are so good at doing peripheral nerve blocks and managing pain for the patients. And this is a tremendous relief for patients who have to undergo procedures that primarily are outpatient. And that really is one of the big goals of advanced orthopedics, is to try to get patients back home.
Speaking of outpatient total joint replacement sounds like a mouthful, but I'd like to hear from you about it and how that works for patients.
Well, it can be a knee, a shoulder, a hip full too, because you know we are replacing the joint with metal and plastic components, and that's a major operation, and those operations cause pain. And our goal is to try to do as many of those as an outpatient procedure, because we have found that patients go home, they're in a safe home environment. You get to go home after your knee replacement and sleep in your own bed. I mean, who wouldn't want to do that? But the only way that's going to happen is if you have fantastic pain control. And that's really what our practice is so good at. And so we can do outpatient total knee replacement, total hip replacement, and even total shoulders, and get qualified patients home. You can't be real sick and have other factors. You have to be a basically healthy patient. And we can get those patients home with their family, and by the next day, we can arrange to have them in outpatient physical therapy. If they're not quite able to do that, we can even arrange for home health care.
And there's something I think emotional about that too. Feels good to be home and get on the road to recovery. So, doctor, that's fascinating.
For sure. I tell you what, I have this one patient. He is from the LaGrange area, and before I joined Advanced Orthopedics, I had done one of his knees. I had done a total knee replacement, and he recovered well, and it took him about 3 months to get over it, and he was doing fine, and he was ready to do his next knee replacement. Well, I'd switched practices The first one I did in a hospital. It's typical way to do a knee replacement. And he recovered what I thought was actually very well. He did really good recovery. However, the second knee, we had the opportunity to do it as an outpatient. And so 6 weeks after his operation, he walks in and hands me his return to work form. Now, he hauls heavy freight with a trucking company. And he hands me his return to work form, and I said, you're not really ready to go back to work yet. It's only been 6 weeks on your second total knee. He goes, oh no, I'm ready. And I looked at him like, you've lost your mind. He goes, watch. And he hops around the room, he squats and gets up and down, and I was afraid he's going to lift me up and throw me across the room. And he was ready to go back. Now, that's a truly exceptional recovery and a really motivated patient. But it just shows you the power of being able to get somebody recovered as an outpatient.
Dr. Albrecht, we really appreciate your time today. Thank you so much.
Well, you're welcome. Thanks for having me.
Is pain holding you back from what you want to do? Talk to the doctors at Advanced Pain Care. Go to austinpaindoctor.com to start getting help today. This segment is sponsored by Advanced Pain Care.